Hey, Dr. Kent DeLay here. Let's talk about a fairly tricky topic. Calcium oxalate kidney stones are the most common type of kidney stone by far and away. So patients often think, well, if this is a calcium-based stone, I should have a low calcium diet to decrease my risk of making these stones. Let's talk about why that is actually a false statement. So the calcium oxalate stone is made of two things. There's the calcium, which is a mineral, and the organic component, which is oxalate. We take both of these things in our diet, and oxalate is actually made by the liver. So it's a little bit of a complicated journey how oxalate comes into the body and gets into a kidney stone. But oxalate, the organic part of a calcium oxalate stone, is absorbed through the intestine, goes into the urine, and makes a stone. But interestingly, it can only be absorbed if it's not bound to calcium. If it is paired together with calcium, they stick together and are actually pooped out. Okay, so I know this is getting tricky, but stick with me for a second. So if you have equal amounts of calcium and oxalate in the diet, they will stick together, be pooped out, so you will not be absorbing a bunch of oxalate. But if you were to try to have a low calcium diet, then the oxalate in your food is going to be more easily absorbed and put in the urine where you form a kidney stone. You don't have to remember all of this if you don't want to, but the key is a low calcium diet will actually increase your chance of calcium oxalate stones because you're absorbing more oxalate. So there are studies that have shown that a calcium oxalate stone former should have a normal amount of calcium, which is usually 1,000 to 1,200 milligrams of dietary calcium.